What's up, everybody? Once again, it's your boy Mala Cesar. You already know. Another day, another chapter. Every day, all day, this is how we do it. Today, we're not going to talk about fashion. We're not going to talk about music. We're not going to talk about finance. We're not going to talk about none of that. We're going to talk about something that very real. Mother's Day is coming, and I feel that, you know something, it is time to share. Share with the world what these eyes has seen, witnessed. So, 2 years ago, I got invited to watch a screening. And usually when I go watch a screening, you know, I'm all excited because I get to meet celebrity, you know, go have a little drink after the party, have a good time, all gravy. But this time, it wasn't the same. Not just that, I was even more extremely excited because Hillary Clinton was on the panel. I'm like, yeah, I'm about to meet me a diplomat, a high value person. So this is definitely like my type of thing. But little as you know, after I watched that movie, my life changed forever. Then I got a chance to listen to these women, and it was like, yo, are you kidding me? So I have to tell you, what I'm talking about is called endometriosis. That's right. I never heard of the word endometriosis until I saw this film. The film, by the way, called Below the Belt. Please look it up. Stream it. Netflix, Hulu, Disney, whatever. This movie is out there. Please take a look at it because it is unbelievable. Below the Belt. And the reason I'm sharing this with you, you might say, wait a minute, I'm a man. What does this have to do with me? I'll tell you one thing. We all come from a woman. We all come from a woman. Okay? So it is very important that we pay attention to these women. It is very important that we pay attention to what these women go through at times. Because honestly, I never knew there was such disease that was out there that, you know, can affect a woman so hard that it's like it could change her life forever. So please, if you don't know what endometriosis is, please take a look at it, okay? Because after I watched this movie, my life changed forever. And I'll tell you one thing, throughout the film, when I was watching it, I was like, oh please stop right, no. I felt like, yo, it's like terrible and disgusted at the same time, but at the same time, I was like, what in the world is this? Why nobody even talking about these things? Why this things is not even out there? You know, this is like, but anyway, listen, with no further ado, please watch the panel. The panel's coming up, okay? Watch the panel and please comment and let me know what you think about the panel because it is very important that you watch this. Again, we all come from a mother and we all have sisters, you know, cousins, and sometimes daughters as well. Please take a look at this. Mother's Day is coming up and you definitely got to pay attention to what's going on because endometriosis is no joke. No joke at all. So, women, be aware of that, okay? So, by the way, if you haven't subscribed, please, this is the time for you to hit the button, go ahead and subscribe. And don't forget to click the like and follow me on my Instagram, which is Mala Speaks Sunday. And I'll be responding to you guys. Okay, so please comment on this video. Let me know how you feel. Let me know if you know anybody with endometriosis, okay? Because honestly, after I see this movie and why I took so long to bring this right now, that'll be on the next segment. But once again, please watch the panel. It's coming up right now, okay? Stay tuned. You already know it's your boy Mala Cesar. We out. Not yet. Watch the panel right now.
Yes, great. Sorry about that. I happen to teach at Harvard Medical School, and we're going to be launching an interdisciplinary curricula, with the film being the linchpin of it, and then exploring some of the health policy issues that come up. You heard about all the insurance issues and the inability to get things paid for, including research, as well as ethical issues that arise. Why is this happening? Why are we failing women, even though they are our patients, and yet we are failing them, and that's our discipline, and why? So we have a whole curriculum developed that will start this January at Harvard, and then we'll make it available to every other school.
May, I was wondering if you could talk. You've been acting since you were quite young, and you have such a productive career and a busy career, and yet you also struggle with, and have struggled with, endometriosis that can be so very disruptive. How do you do it? How do you manage? How do you work around it?
Not easily. You know, first of all, I just have to acknowledge, from the first frame of watching this, I just cried the entire time. And I just have to acknowledge every incredible person up here. Can we just get one more round of applause for how great they are? I just feel like so honored to be sitting here with you guys and with everyone up here. You're my heroes. But you know, I started when I was 3, and for me, I started having pain that we thought was digestive, and you know, they said it was lactose intolerance because it was the 90s and everything was lactose intolerance, and so, you know, when I was about 7 or 8, and I too went through such debilitating pain to the point where I lost jobs. I had to quit jobs. I didn't show up for jobs. You know, my job is like so much of who I am, and I consider myself to really be the utmost professional, and as I'm sure everyone here knows who suffers from this, the feeling of not being able to do what you love, whatever that might be, and not show up as the person that you know you can be. And especially when you suffer from a condition that nobody really acknowledges as being real, it's very difficult. And so for me, I just pushed through it for years. I just, you know, I plugged in a heating pad and I loaded up on whatever painkiller I was being given at the time, and I got sick in the bathroom and barfed between takes, and, you know, was shaking, and, you know, I just thought this is what it has to be. And I went to so many doctors, I mean, over years and years in Los Angeles, people that came so highly recommended, and they all would stare at me with this vacant, blank, almost frustrated and sad face and say the exact same things that you hear of, well, you should go on birth control or get pregnant. I mean, you know, I was 22. I was like, you know, working, and because otherwise it's this really complicated disease it's really hard and it never goes away to get rid of. So, you know, and I was like, what is it? And so, you know, for me, it reached a point where I also had to go to the hospital, and I was put on morphine, and it was just, it was so absurd that I was like, I actually feel like I'm going to die. And so that's when I finally was put in touch with Dr. Orbuch, who is my hero. I'm sure she's the hero of a lot of people here, but she is truly my hero in this world. I love and respect her so dearly. And now, you know, a lot of my jobs they integrate. I mean, just today I was at work all day, and my bosses came up to me and said, we're gonna take time, we're gonna give you time off on the days of your cycle, so we want to talk about when your cycle is, just so that you can rest and relax. Myself to say, this is what I need, this is who I am, this is a part of who I am, and I need this in order to do the best job. So I'm just so proud of you guys, and I thank you for having me.
Thank you so much. Thank you so much. So even the surgery was helpful to you, but not 100%. You still have
surgery was incredibly helpful for me. I mean, I have my life back. You know, for me, my period was so unpredictable. I mean, it would come, you know, every 3 weeks, every 2 months, and the pain would hit out of nowhere. It would be really long. I mean, I had about 2 good weeks of my life, and then the other 2 were just filled with so much pain, and it's that ephemeral pain, and it's the feeling of being gaslit and being told that what you are feeling isn't real and you can't quite pin it down, and it really adds to the depression, the anxiety, you know. And I didn't have any friends who felt this way, and so for me now, I mean, through the entire program of, like we like to say, beating it, and not, you know, curing it, because there really isn't a cure, but you can beat it and you can manage it. And you know, it takes dedication, but it's so worth it to have my life back, to have energy again, to be able to work and show up as the person I know I can be. I feel much better. The duration of my symptoms is much shorter. I know exactly when it comes. I know exactly what to do. And I owe that all to Dr. Orbuch, seriously.
Dr. Lee, I was wondering if you could explain to us, why does it take so long to get a diagnosis? I saw you on YouTube saying the 3Ds, and I don't want you to say the 3Ds here because nobody's going to know what they are, but basically painful periods, painful intercourse, and constipation. As a triad of symptoms that should signal this to doctors who are examining women, evaluating women.
Can you hear me? Okay, perfect. Yeah, thank you. I think, I mean, the last part was painful bowel movement. And so the 3Ds are very basic, right? I mean, dysmenorrhea is painful period, dyspareunia, painful intercourse, and dyschezia, painful bowel movement. It's a very basic symptoms. And those are the very easiest thing you can ask patients, and frequently they are something that a lot of doctors don't ask. And it's very important. I'm actually very sad. Actually, this film actually was very sad to see all those patients who have to spend so much money, even taking out mortgages to pay for their surgery. And, you know, how about those patients who, you know, who cannot afford to pay for their surgery? And also too is that we have a big issue with the access and quality of endometriosis care in this country. And basically is over years of systematic challenges that has been set up in the healthcare system that really need to change. For example, the diagnosis codes for endometriosis has not changed since the 1970s. Okay, we have the same 8-9 codes for endometriosis that has not changed. And this past few years, I've been working with CDC to change the diagnosis codes for endometriosis. And so for the first time in over 40 plus years, we're gonna have an extremely expanded diagnosis code for endometriosis. So currently, if you have endometriosis of your diaphragm or endometriosis of your bladder, they are considered other diagnoses. So basically, everything that doesn't fit into the other 7 or 6 codes, it fits into other diagnoses. So you have no idea as to, you know, like what's the epidemiology of bladder endometriosis? What's the epidemiology of diaphragm endometriosis? Because you don't know, because they all throw into that wastebasket of other endometriosis. And that's one of the issues that we have overcome. So I think this will be announced by CDC sometime in June or July. It will be implemented in October this year. And also, obviously, we have issues with, you know, the procedure codes for endometriosis. Currently, there's only one code associated with, you know, surgery for endometriosis, as Dr. Orbuch mentioned in the film, that it can range from something that would literally take seconds, you know, I mean, literally seconds to ablate a few spots of endometriosis versus excisional surgery for severe endometriosis with ablation of the cordyceps. And as far as the insurance company is concerned, they are the same, but they are not the same. So what happens when you try to teach, you know, I have taught like generations of fellows over the years, but yet I'm teaching procedures that has no codes for it, okay? So basically your work is not value because there's no codes to go with the procedure they perform. And I don't blame you know, a lot of good endometriosis surgeons decided they won't participate with the insurance company, decided they'll be taking fee for service. But things need to change, you know, for people to be able to be validated for their diagnosis, be validated for the procedure they perform. And I think with people like Shannon Cohn, I first saw Shannon Cohn on YouTube, on a TED Talk. Okay, and I Googled her, who is this person? And I saw her with Warren Hatch, with Elizabeth Warren, and say, well, this is the person I need to know. Because I was at that time working to help to change the surgery code, the procedure code for endometriosis, and I was met with a lot of obstacles. And it's really something like this is for, we really need to have patient advocates and the legislators to work together with the surgeons or the medical professionals to make things to improve the access and quality of care for endometriosis surgery. You can pay thousands of dollars and you have no idea the quality of your surgeons. You think you're paying cash, you think a good surgery. There are a lot of patients, a lot of surgeons who do fee-for-service, they're great surgeons, but you don't know who those people are. Okay, and at the same time, there are also good endometriosis surgeons who work in university hospitals. And a lot of times it's a mystery to the patients. So we want to work in a system that things are much more transparent. We know who are qualified endometriosis surgeons and who are not. And obviously, we're going to be met with a lot of obstacles, a lot of political issues with that. But I'm sure with help, with the patients' advocates' help, and then advisory from medical professionals, we can make it happen. Thank you.
What is the cost of fee-for-service excision surgery? And
I don't know. I don't do
vary?
that.
Huh? Does it vary depending on how extensive the Dr. Orbuch, depending on how extensive the need is and the disease is? Would it vary once you see how long it's going to take?
I think it's, when we think of a global fee, it's the anesthesia, the hospital cost, the pathology cost, the surgery cost, and it's all inclusive. But I think every surgeon has different fees, but I don't think it's based on extent. It's just based on the actual surgery itself.
But for the most part, people who are doing that are not going to be getting run-of-the-mill insurance reimbursement because it's just not sufficient.
Because as far as I know the numbers, if I took insurance and I did an 8-hour surgery, I would be reimbursed about $600 from insurance companies. Like, I can't even run my office and pay my staff and give them health insurance when I'm in the OR. So that's why what Ted is doing is so important, because we need to change a broken system. This surgery is really hard. You're operating on the bowel, you're operating on the bladder, operating on the diaphragm, operating on large vessels. There's so much risk involved in the surgery. I mean, you have this patient's life in front of you, and to be reimbursed $600 is just, I don't know, a plumber comes to my house, I have to give him a credit card 48 hours before they come. But a surgeon, we wait 6 months or a year to get the $600. The system is broken, and I really applaud what you're doing to help change the system from the ground up, and what Shannon and what the Hatch family is doing to bring Congress involved and changing everything.
Yeah, you need policy change, we need a lot of education. So, Mary Alice, I was wondering, when you were going through this as a caregiver with Emily, when did you first realize that something really serious was going on and that you really had to get to the bottom of it? Because you did get to the bottom of it pretty quickly.
Yeah, I mean, we were fortunate from the time Emily first had her acute pain attack, which was at a Taylor Swift concert, and she was doubled over in pain. We had to go to the emergency clinic at the stadium, and then it progressively got worse and worse and worse. And so she was having a lot of abdominal pain, and a lot of times endometriosis presents itself as GI. And so that's very confusing, because they go in with all these GI symptoms, and then they get misdiagnosed. So they told Emily she had IBS, irritable bowel syndrome, which is kind of that pot they put all the unknowns into and just say, you have that. I knew in my mother heart that was not true. And and we were doing all the treatments he was suggesting, and nothing was working. And in my heart, I just knew this is wrong. This is not what's happening. And so I just started doing research online, and I just decided, okay, I need to get her a pain therapist. She was suicidal. She was in so much pain. And so I opened the yellow pages back in the dark ages, the Gen Z kids, what is that? And we opened the yellow pages, and there was one pain therapist in there, and I called her and I explained what was happening to Emily, and she said, I think your daughter has endometriosis. And I'm like, what's that? And so I go online, I'm Googling, and I find a very good surgeon in Boston, at Children's Hospital Boston, who does diagnostic surgery, and got her in, and she had endometriosis. So I would say to parents, follow your instincts, because it's very easy to follow the advice of professional medical people, but you know your child, and you know, I just think Heavenly Father gives us this gift as mothers to watch out for these children. And I took it seriously, and I got to the bottom of it, and I was very blessed to have former Senator Orrin Hatc as my father-in-law, who passed recently. Incredible man, as you probably all know, bipartisan, and he was willing to go to bat, and we were going to make some changes. And so I am so grateful for this opportunity that we had to get Emily help within 18 months. We went to Mayo Clinic, Boston Children's Hospital, Mass General. We're seeing the best of the best, and no one knows what's wrong with Emily. And we just were blessed to, I swear God led me to that pain therapist who told me endometriosis, and we got here, and he wants us doing this right now.
So again, it's like I think Jenneh's boyfriend said, or husband now, you know, Facebook knows more than some doctors. So, and you had a pain therapist who just threw that out, and you were able to get to it. So back to Dr. Orbuch, is this now the standard of care, the excision surgery, or have we not gotten there yet? Is that part of the problem? Enough evidence, enough experience, enough certitude that this is the correct standard of care, and therefore it should be covered. And
I pray to live to the day when I can say that excision of endometriosis is the standard of care. And I think that's what all of us up here are working towards. I would say, and everyone please correct me if I'm misquoting, I think 99% of doctors are still performing ablation surgery, if they're performing surgery at all. And the problem is that most people who go under the knife and have surgery, their surgeons don't even recognize the varying appearances of the disease. I learned 2 appearances of endometriosis in my residency, and I often tell patients that I learned more in my first week of fellowship than I learned in 4 years of OBGYN residency, plus 4 years of medical school training. So in a combined 8 years, I learned less than in my 1 week of fellowship. So I felt so sad in that first week of fellowship when my amazing mentors, who are like father-like figures to me, and they're still part of my life, when they were pointing out, this is endo, it's red, it's blue, it's brown, it's white, it's clear, like my heart sank for all of those patients who I was the resident in the surgery assisting, when the attending surgeon went out and spoke to them and their family member and said, we didn't find anything, there's nothing wrong. Because I said, I have seen that, and I've seen that, and I've seen that, and I've seen that, and I've seen that. So the problem is, most physicians, most gynecologists don't recognize the disease. And then I was taught how to do the wrong surgery in residency. I was taught how to do ablation of endometriosis. We have prospective randomized 5-year placebo-controlled data that shows that excision of endo is better than ablation. So it's technically difficult, it's very hard to do, and really, I think Shannon's work is really what's pushing the needle towards making excision the standard of care. And I think that's what all of us here collectively have to do to help so many of those who are suffering.
Well, that's brings me to my next question, which is, the long-term outcomes for the surgery. And Jen, I want to ask you about that, because the movie, it's all kind of consolidated together, condensed in time, but actually you had the surgery, is it 6 years ago?
May 19th was 6 years, officially. Yeah.
And you had such relief in the film. Has that lasted?
Yeah, so I mean, to paint a picture of what my life was like before excision, I was 27 when my symptoms started. I had just landed my dream job at UCLA as a nurse manager. I was finishing grad school. I was like on my way to doing everything that I wanted to accomplish, and then this thing just came and ruined everything. And I had to quit work. I had to go on disability because I couldn't take care of patients, being in the pain that I was in and having the brain fog I was having, and just like needing to take care of myself. So I went from being very capable to basically just existing. My everyday was wake up, take pain meds, lay around, try to put myself to sleep so I don't have to be awake. I had a rare form that was on my diaphragm, so every breath that I took felt like somebody was stabbing me in the chest, and how do you exist that way? I felt hopeless. I felt like if this was what my life was going to look like forever, is this a life that's worth living? I can relate to how Emily felt, to being not suicidal, but thinking, what is the point of a life like this? And since my excision surgery, I haven't had any pain related to endometriosis at all. What I will say, I'm pain-free, thank God, but there is not a day that goes by that I don't know what this disease did to my body. I need 10 pills a day just for my bowels to work the way that they're supposed to. My body will never be the same again. And I always just wonder, if I had gotten diagnosed sooner, would that have been a different story? And that's the work that all of us are trying to do, is to make that story true, that we find out sooner, there's less organ damage, people aren't losing organs to this disease. Early intervention, early diagnosis.
And when you think about how much IBS there is out there in terms of diagnoses, I mean, so many young women have IBS, and you kind of wonder, is it IBS or is it endo?
Absolutely. It was actually with meeting with Dr. Orbuch post-surgery. She's closer to me than the CEC in Atlanta is, so she kind of helped me out post-surgery. And she made it very clear to me after taking a whole history, and I did explain to her, like, I've been constipated pretty much my whole life. I just thought that was normal, and she kind of painted that picture that, like, no, this was likely an early symptom that just was normalized for you.
Well, a lot of pain for women is normalized, and Dr. King, I was wondering if you could talk about that and how women are told their periods should be painful, or, you know, what, you're going to the doctor because you have painful periods? Really? What do women need to know? What does everyone need to know about what is normal, and just the communication? And there's so many taboo words that we don't want to talk about and are worried about saying out loud.
Absolutely. No period pain really is normal. So any period pain that is debilitating, especially if it's keeping you from doing anything that you wish to do, whether it's school or work or whatever, should prompt an evaluation by someone who is an expert in this. And that is hopefully all of our goal, that eventually people will be able to access more and more experts who would initiate the correct evaluation right off the bat. But as a society, and this is true around the world, we tend to diminish women's pain. I'm also a mom to a 16-year-old with endometriosis, and despite being an expert in it, despite being a surgeon who does excisional surgery, I still told her a few times her period pain was normal before taking her to be seen. You know, it's just oh, you're okay, just take some ibuprofen. We really just need to get away from doing that. And she never lets me forget that I did that, by the way. But, you know, it's everywhere. I think anytime anybody presents to you and says, I'm in pain, you need to investigate more deeply. And there are a multitude of studies that show that physicians turn women, especially women of color, away when they say they're in pain, and diminish their pain and don't treat it adequately. And it's really a huge problem, one that we're trying to fight through education primarily.
So you're making a distinction between cramps, cramps and pain that is debilitating and can't be controlled with any over-the-counter medication?
If it's impairing your ability to do something you want it to do, if you wake up that morning and say, I'm having menstrual cramps, but I'm gonna stay home the whole day, that's a lot more. I mean, we all want to be normal. I heard that in the film a few times, and my daughter says that to me all the time. I just want to be normal, and so she'll try to pretend that she's not in pain, even though she's in a tiny little ball on the floor. And so we also have to encourage people to say, no, let me help you. But they've been told so many times that it's nothing and to suck it up, that of course that's where they go with it. So to some degree as well, we have to really listen and ask questions and say, well, any person that comes to my clinic, I say, what's your month like? You know, how many days are impaired by this? And if it's more than one, in fact, if it's even one, that's 12 days out of a year if you pack them all together. That's unacceptable. We need to have a better quality of life for you.
Thank you. Heather, I was wondering, you've been in this area for a long time. Have you seen progress? Are you seeing greater awareness? Are you seeing people getting to care more quickly?
So you gave me the easy question, huh? Okay. Have I seen progress? Absolutely. Now, that comes with a caveat. You know, a couple of the things that we're not really touching on up here, which, you know, I like to dive right into. We're not really talking about the fact that there are guidelines that basically eschew surgery as an option and demand imaging and ultrasound and clinical diagnoses and immediate track to medical therapy, taking surgery away as an option for some folks. We're not talking about that. We're not talking about, you know, outside the box. What does that patient look like? A rich white woman? No. It's BIPOC, it's trans, it's gender diverse, it's gay, it's lesbian. Endometriosis doesn't look just like me, it doesn't look just like Jenneh, it doesn't look just like me. It's a disease that affects all of us. It's not just something you can pigeonhole and put in a box. So we really need to open up the borders of that pigeonhole that we're looking at. And yes, menstrual education is critical. Menstruation as it relates to the disease is an important discussion. But let's talk about the people without a uterus, people who don't menstruate, people who are still having cramping, pain, diarrhea, dyspareunia, crippled lives, can't work, can't go to school. Let's talk about them and extract the period. This isn't just a period disease. I know that's a very popular buzzword, but it's not. There are people who don't menstruate for whatever reason that still have endometriosis, still have pain, still don't have access to care. So there's a lot of areas that are still neglected, still held in the shadows, still lacking, that absolutely need and deserve progress, critically so and urgently so. With that said, I do think that progress has absolutely been made in terms of recognition, and you can thank people like Shannon Cohn for that. You can thank people like Representative Jillian Gilchrist. I don't know where you are, stand up and wave, because what some of you may not know is that Jillian has spearheaded an incredible legislative bill out of the state of Connecticut, which, yes, absolutely. Thank you. She has formulated with her vision and her mission of her endometriosis working group, which I'm honored to be a part of. She has spearheaded incredible legislation, not only towards establishing a biorepository formally, but also requiring education, which is something that is so sorely lacking. I mean, Dr. Lee will tell you, Dr. King will tell you, Dr. Orbuch, all doctors will tell you, the education at the professional level is not enough, and what we do have, a lot of it is incorrect. So people like that, that's where your progress is. You know, look for the helpers. Look for the people who are gonna say, I've been on this journey. Someone like me who underwent 22 surgeries because nobody showed me the way. We're here, we're gonna help you. And progress is being made. There are incredible people working so hard every single day, you know, in the trenches, in the arena. And I know what this community looks like. I know there's a lot of divisiveness. I know there's a lack of unity in a lot of spots, but more often than not, we are all more like-minded than you would think, and we all work together. So I want you to be heartened by that. I want you to be encouraged by that. We're not gonna let this disease get forgotten till my dying breath, and probably to all of their dying breaths too.
I think that's to what Heather was saying about the guidelines and how important that is, that we have ones that are updated and adequate. I work in primary care, so my physicians are using these outdated guidelines to figure out what to do with their patients that come to them with endometriosis type symptoms. So I know they're not being the right thing from the gate, and how do I argue that a board that's supposed to be giving them the right guidelines isn't? But listen to me, I know better. So it's really difficult, I think, right out of the gate for patients to get an assessment that is accurate when their physicians are using outdated guidelines. And then secondly, I think another thing that's changed is that patients are getting louder, and we're not taking this subpar treatment anymore. We're sick of it, and we're banding together, and we're going to